Cassie, what is autism and how do we know what it is?
Well, autism is a neurological disorder, so its basis is in the brain. It affects social communication and behaviour. We can see, deficits in things like the way people interact socially, how they respond socially and emotionally, how they use non-verbal behaviours like eye contact, facial expression and gesture, and how they develop relationships with other people, or in some cases don't develop relationships with other people. We also see, the stereotyped and stereotypical behaviours like repetitive behaviours, lining things up, flicking light switches, pushing things back on the forwards over and over again, really fixated interests on particular topics, sensory issues like being really sensitive to different sensory input, or under-responsive to sensory input as well.
And how is an individual diagnosed with the autism spectrum disorder?
It's a pretty complex process, and it can take a long time and a long journey for people going down that path. Basically, there's a series of assessments that we do that have been, standardised across lots of different people and researchers, where you will observe the person, usually a child. We do have adults that are diagnosed, but generally children. You'll observe a child in a playful situation, in a sort of an unstructured situation. There'll be a formal interview with a parent or carer, and then discussions with other people known to the child, like school teachers, like doctors, occupational therapists, psychologists, people that they work with, child carers. And then all that information is put together, and there's a set of criteria that the diagnostic clinician will look at and see if enough of those criteria are met to diagnose an autism spectrum disorder.
So why is it referred to as a spectrum disorder?
Really good question. It is a spectrum because no two people with an autism spectrum disorder are the same. So with the diagnostic criteria that we use to diagnose autism, there are clusters of behaviours that we're looking at, but there's nothing definitive. You can't diagnose autism with a blood test. So there's a blood test that shows the same kind of characteristics for every single person. So where we talk about, for example, deficits in non-verbal behaviour, it doesn't mean the same lot of non-verbal behaviours that are deficit in each person. So every person will present slightly differently, but there's a cluster of symptoms that are collected together that represent an autism spectrum disorder.
Do we know how and why autism happens?
It's a really good question. It's a difficult question to answer because we don't know definitively what causes autism. We do know there's a genetic component. So we do know that there's a very high percentage of kind of generic characteristics passed down through family. So if you have a child with autism, there is a high probability that another sibling will have either a diagnosis of autism or very strong autistic traits. That said, I do know identical twins where one has a diagnosis of autism and one doesn't. So genetics doesn't explain every single case of autism spectrum disorder. We do know it's neurobiological, so it occurs in the brain, but again, we're not yet at a point where we can say exactly what causes it.
What can be done to assist individuals on the autism spectrum?
Look, we know a lot more than what we did 20 years ago in terms of what works. Obviously, early intervention, so the earlier a child can be diagnosed and the earlier we can intervene and teach replacement behaviours and teach how to increase the deficits or improve the deficits that the child is facing. We know their prognosis is going to be much better. So I guess there's like a two-pronged approach. We can work with the child or the young person and work to help them develop skills in communication, in social interaction, and in developing more functional behaviours. But we can also, I guess the second prong of attack is also to look at increasing awareness and making environments more friendly for people on the autism spectrum. So looking at the sensory aspects of environments. I mean, I think Coles is a great example, creating their sensory friendly hours in the supermarkets where they, cut the noise, dim the lights, cut the noise of the scanners. So it's a more, I guess, friendly environment for people that have sensory sensitivities.
And approximately how many people does autism affect?
There are a few statistics that are out there. I think the most common statistic is 1 in 100, I guess because it's nice and round and even. But I think the most up-to-date sort of statistic that we're using now is actually 1 in 68. So that's, if you look at a school, that's 1 in every 2 classrooms would quite likely have somebody on the autism spectrum.
Do we know why autism is more common in boys than girls?
Funny that you say that. The statistics say that it's the ratio is 4 to 1, so 4 boys for every 1 girl. But we know that autism is underdiagnosed in girls, and it's very hard to detect in girls. So we think that the ratio is maybe slightly higher, at least 2 to 4, if not 3 to 4. We think it might come down to genetics, and it might come down to brain makeup, but we don't know for sure why the gender difference exists.
Are people with autism more susceptible to other issues such as mental health or other forms of disability?
Yeah, definitely. So there's a lot of comorbidities, so where other diagnoses exist with the autism spectrum disorder. So things like ADHD are really common, reading disabilities are really common, even anorexia and eating disorders are really common, have a really common overlap. And then mental illness and anxiety, I think. One of the statistics, although I'd probably argue that it's higher, they're saying that about 30% of people on the autism spectrum experience an anxiety disorder as well. I would argue that that could possibly be even higher.